right, so we had a question about calluses. There are many different shapes and sizes of calluses, and there's many different things that can cause calluses, ranging anywhere from the type of gait that you have to warts can also produce callus. In the case of our patient today, the callus was caused from a foreign body that had entered the foot approximately a year ago. And what had happened is we removed the foreign body, got everything out, but because the skin then was interrupted, and it was a weight-bearing surface, she had to keep walking, the body continued to produce callus over that area. Now, so there's several things that we do to help in prevention of developing that callus. But first, what we do is we address the discomfort itself. And so what I'm going to do is I'm going to show you how I reduce the callus, and then we'll talk as to how we can prevent it. So what we do is, first of all, we make sure we do a little bit of softener on the area. And again, I recommend don't doing this at home. But what we're trying to do then, and I use just a blade, is I'm removing the callus, and this is a fairly mild one. There's sometimes they're much larger than this, but you can see how there's very focal callus right there in the center. It almost feels to her like there's a pebble in there, like a rock. And so what we do is we just trim away all of the surrounding callus, and then you saw how that central area just kind of popped out. All right. So how does that feel?
Great.
All right. So what we try to do is we try to get as far down to the core, the base of that, as we can. And so, yeah, then it starts to feel a little uncomfortable. She starts to pull away. But we try to get right to the base so that hopefully we can prevent that from coming back again. So how do we prevent that callus from building up? Well, there's creams that have keratolytics in them. Anything from lactic acid to glycolic acid, even urea, can help to work on the callus at the base there. And then what we do is use something called a pumice stone. You can get those from most pharmacies. We also carry them in our office for patients' convenience. And you use those after your bath or your shower. That can also help to get rid of the callus so that it's comfortable. Also, orthotics can be helpful as well in removing pressure away from the area where the callus is formed and transferring it to other parts of the foot. And we can do some modifications with an orthotic to help with that. And we do those orthotics also here in our office. So that's callus.